If you wake up feeling stiff and heavy, as if your body has turned into rusted iron overnight, and the first few steps of the morning feel tight, uncomfortable, or even slightly painful, please know that you are not alone. This is one of the most common complaints I hear from my patients over the age of 60. Often, there's a fear that this stiffness is a sign of permanent decline or severe injury. However, more often than not, your joints may simply need gentle movement before you start your full daily activity. Think of your body as a high-quality machine that has been sitting in the cold. It doesn't need to be replaced, it just needs to be warmed up properly. As a medical professional, I want to explain exactly what is happening inside your body when you wake up. After 60, the circulation of synovial fluid, which is essentially the natural oil that lubricates your joints, slows down significantly during the hours you are asleep. When you are stationary for 6 to 8 hours, this fluid thickens and your tendons and ligaments lose some of their elasticity. This is why you feel like you need a few minutes just to get going. The good news is that gentle mobility restores motion by stimulating that fluid and increasing blood flow to the tissues. Today, I want to walk you through a specific low-impact morning routine that you can perform right at the edge of your bed or in a sturdy chair. We're going to focus on 3 foundational movements that address the spine, the knees, and the ankles, the 3 pillars of your mobility. Let's begin with our first movement, the seated spine rotation. This is critical because your spine is the central highway of your nervous system and the anchor for your entire posture. When a mid-back or the thoracic spine is stiff, it places a massive amount of extra stress on your lower back and your neck. To perform this correctly, I want you to sit tall at the edge of your bed or chair. Ensure your feet are planted firmly on the floor, about hip-width apart. This creates a stable base. Now, imagine there's a string attached to the crown of your head, gently pulling you toward the ceiling. This elongation of the spine is vital because it creates space between your vertebrae. Place your hands lightly on your shoulders or across your chest in an X shape. Take a deep breath in, and as you exhale, rotate your upper body slowly to the right. It is very important that you do not force this movement. We're looking for a gentle stretch, not a sharp pull. Only go as far as your body naturally allows. As you turn, keep your hips and knees facing forward. The rotation should come from your waist and rib cage. Hold that position for a second, then slowly return to the center as you inhale. Now, repeat the motion to the left side. We're going to do 10 repetitions on each side. While you do this, feel the muscles along your ribs and back beginning to wake up. This rotation helps to wring out the tension in your spinal discs and encourages blood flow to the small muscles that support your posture. If you feel any sharp pain, simply reduce the range of motion. Consistency is far more important than intensity. Moving down the body, our second exercise is the seated knee extension. The knees are often the most common site of morning discomfort because they bear the weight of your entire body the moment you stand up. By performing extensions while seated, we can lubricate the knee joint and activate the quadriceps muscles without the stress of your body weight. While remaining in that same tall, seated position, ensure your back is straight. Slowly extend your right leg forward until it is as straight as you can comfortably get. Once your leg is extended, I want you to hold it there for exactly 2 seconds. This hold is the most important part of the exercise because it engages the muscles around the kneecap, providing stability. You might feel a slight tension in the front of your thigh. This is exactly what we want. After the 2-second hold, slowly lower your foot back to the floor. Do not let it simply drop. Control the movement on the way down. This control improves knee mobility and strengthens the structures that protect the joint. Repeat this 10 times to the right leg and then switch to the left leg. This exercise helps to pump synovial fluid through the knee joint, acting like a natural lubricant so that when you finally do stand up to walk to the kitchen or the bathroom. Finally, we must address the foundation of your movement, the ankles. Our third exercise is gentle ankle circles. People often overlook the ankles, but they're the first point of contact with the ground. If your ankles are stiff, your balance is compromised and your risk of a stumble or fall increases. Furthermore, the ankles act as a secondary pump for your circulatory system, helping to move blood from your lower extremities back up toward your heart. For this movement, you can stay seated. Lift one foot slightly off the floor. Just a few inches is enough. If you need extra stability, you can hold the side of your chair or bed. Now, rotate your ankles slowly in a large, circular motion. Imagine you are trying to draw the largest circle possible with your big toe. Move slowly and deliberately. We aren't just flailing the foot. We are looking for a full range of motion. Do 10 circles in a clockwise direction, and then 10 circles counterclockwise. You might hear some clicks or pops. As long as they aren't painful, these are usually just gas bubbles or tendons moving over bone, which is perfectly normal. Once you finish one foot, switch to the other. These ankle circles restore circulation to the feet and wake up the proprioceptors, the tiny sensors in your joints that tell your brain where your body is in space. This is the single best thing you can do to improve your balance first thing in the morning. By the time you finish these 3 exercises, you will have spent about 8 to 10 minutes focusing entirely on your physical well-being. This isn't just about physical therapy. It's about sending a signal to your brain that it is time to move. It transitions your body from a state of rest to a state of readiness. I want to emphasize one final point as a doctor. Listen to your body's feedback. Some days you will feel more flexible than others, and that is okay. The goal of this routine isn't to reach an Olympic level of flexibility. It's to reclaim the comfort of your daily life. If you do these 3 things, the spine rotations, the knee extensions, and the ankle circles, before you even put on your shoes, you're giving your joints the oil they need to function. You will find that those first few steps of the morning transition from being a chore to being a graceful start to your day. Remember, aging is a natural process, but stiffness does not have to be an inevitable shadow over your golden years. Movement is medicine, and the best time to take that medicine is the moment you open your eyes. Take your time, breathe deeply, and move with intention. Your body has carried you through 6 decades of life. These few minutes are your way of saying thank you and preparing it for many more active years to come. Start tomorrow morning, and I think you'll be pleasantly surprised at how much lighter you feel. Be patient with yourself, stay consistent, and keep moving. You have the tools to feel better starting right now. Great job taking care of your body today. If you'd like to keep improving your balance, strength, and mobility after 60, watch the next video on your screen now.